Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Welcome back to another Practice Plan podcast, everyone. And I'd like to say thanks to Rick for joining us again. For those who might have missed our last sort of informal chat or discussion, or however else you want to describe it, I'd just like to Rick to introduce yourself again for us, please.
Hi, thanks, Hussein. My name's Rick. I'm a practice principal and practicing dentist in Sheffield, and I'm also the CEO of Psynergy Mental Health, which is a company devised to improve the mental health and wellbeing culture of dental practices and other organisations. Great to be back.
All right, so last time, I know we focused on really what was like being an associate, what associates could do to help their situations, and also what principals could do, and how it was a two-way relationship. Today, I thought we'd touch on more of the whole team, and I think the first thing we should probably mention is, why do you think well-being or is so important to a practice functioning and the actual team dynamics that go on within it?
It's the cornerstone of any business. If you think about a business, people will automatically go to bottom line, but bottom line is determined by the culture of your business, in a sense. Okay, if you've got a really good culture in your business, then your productivity will improve, and you will reduce the effects of poor mental health. You'll create happy, healthy, engaged team, which will increase productivity, which will improve your bottom line. So mental health and well-being is hugely important for those people who are purely focused on business analytics. But I believe it's also important, massively, probably even more so, from a human factor, from a human connection factor, from doing the right thing by your people and doing the right thing by yourself as a business owner as well. It allows you to feel good about the work and the services you are providing within your company.
I mean, this is obviously something that's come up a lot more recently. I mean, I graduated in 2009, and I think when I graduated, all the focus on CPD and workplace training was literally very much clinical. That was kind of the main focus on what different courses were out there and what you could do. And I think the culture's really changed now, because the culture now is very much about how there are a lot of different CPD courses. They're actually geared up towards well-being and looking after yourself in practice, not just, I think, as an individual, but also from the wider perspective. I suppose, why do you think this has cropped up a lot more in this 15 years, or even maybe in the last 10 years? Because there are specific businesses that are just actually geared on not any clinical courses, just focused on kind of like wellbeing courses, and even just for dentists.
Yeah,
really
massive shift. I'd probably even narrow that down to the last 5 years. I'd say COVID had a huge impact on people's mental health and well-being, and it allowed people to possibly reset their goals and maybe re-understand what's important to them in their lives. The mental health narrative is being talked a lot more, which is fantastic. We are in danger of over talking about it and not doing enough action, maybe something known as well-being washing, which is a worry for me, being in this space. But I think there's a huge shift in what people want from their lives. I don't think it's just about the dentistry anymore. I think it's about feeling happy. I think it's about addressing those problems that we have, such as perfectionism and compassion fatigue and all those things that come with poor mental health. I think there's a real important shift now towards looking after ourselves and realizing the importance of that. And again, going back to that whole aspect of productivity, for instance, if we're in a mentally healthy and a better place, then our performance increases, our performance improves, and that gives us an enormous sense of achievement. So I think more and more now, and especially younger practitioners coming out, they are more attuned to this situation. I mean, I qualified 10 years before you, saying, and we never used to speak about mental health and well-being. It just wasn't even a topic of discussion. It was a case of crack on, do your dentistry, and do whatever you need to do to get through, sort of thing. You know what I mean? So I welcome the change. With regards to courses, I think there's a lot now out there just on sort of leadership and well-being, and I think that's a really nice welcomed move as well. It's not all just about the clinical skills, because I do think that focusing just on the clinical skills leads to things like perfectionism, which causes issues for us as practitioners.
I'll agree on that, because perfectionism is, I suppose, a big thing. I mean, I know it's something that I have issues with, but I think that's not just myself. I think that's actually with a lot of dentists. But I think I also find that with nurses, because they kind of would like things having done. They're very keen to make sure that they, do the best for their patients, and create that sort of environment. And it's difficult for people to appreciate it. I think when you recognise it, perfectionism, I think, is one of the harder things to actually try and, I don't want to say treat or combat, but I think to actually make sure that you're not sort of overdoing it within your workplace environment. And I know practice plan are very keen to make sure that good practices are created with sort of good environments, and things are well looked after. What kind of support do you think is actually helpful within practices? Because again, there's so many different resources you can go to, but sometimes it's how do you sort of try and just create that?
I think the biggest thing I would do is you need to gain an understanding about what's happening within your practice and what's happening amongst the entire team, including yourself. So I think having resources that allow you to capture that data so you understand what is happening is crucial. I think once you've gained an understanding of what is happening, you're then in a position to act upon it together as a practice. I think that word together is very, very, very vital. It's not just about me as the practice principal having to make these changes or implementing all the changes to try and make the practice a better place. It's about all of us coming together to create changes and implement them to making the practice a better place. Okay, so I think, but where do you start without understanding what is happening? Where do you start? How do you go about that? You could do appraisals, and you might get some honesty, you might not. So I think capturing high quality data is really important. Okay, then acting upon that data, and then constantly having open, honest communication to build that psychological safety amongst all the team members is crucial to then carrying that forward and building that culture on a wider level. So I think I think sometimes as principals and as dentists, we sort of get lost in what we think is best for the practice, but actually that's not the best way. And more often than not, the wider team of the practice manager, the nurses, the receptionists, etc., they will actually give you more valuable insights. And we'll all agree as dentists that if our team are happy, it makes our job so much easier, for sure. So I think capturing that is.
I think I've got sort of two questions I suppose lead on from that. The first one is, I think you mentioned about how do you actually find this information out, and you said about appraisals, and appraisals, are recommended on an annual basis because it's just part of the way that your business should function. But one of the things that we did in our practice was we actually, and this was Jo Clark, who appeared on a different podcast, was actually, doing one of her surveys, which was the ADA survey, which is kind of the assessment of dynamic adaptation, which is kind of a published bit of research and actually a published questionnaire. So it's got evidence base behind it, and then you kind of redo that survey again a year later or 6 months, something like that, depending on what they recommend. But what other tools do you think could be useful in terms of actually how do you find out this information from your practice teams?
I think what you just mentioned is a great idea, and it's very similar to what we do. So at Psynergy Mental Health, we've devised our own platform for dental practices. So in my own practice, I run this once a year, because we ran it initially for twice a year, and now we run it to once a year, and we run an extensive mental health and wellbeing questionnaire based around the HSE management standards, capturing data across 5 key categories. So your job roles and demands, the workplace environment itself, your relationships at work, the support you're giving to people at work, and their own personal well-being. And we have an extensive questionnaire. It's about 110 questions. But we're measuring mental health and well-being here. Okay, I make no apologies for it. We're trying to understand what is happening. By having that data and having all that data come into an automated system that just compiles all results instantaneously, I've got at my fingertips a full picture of what's happening. Okay, we also gather qualitative data. It is anonymized. The platform is anonymized. In my practice, it is quite small, so there's only 6 people that work in my practice, so I'm going to know who's typed what. But I've set that scene before I've even embarked on it. I want to know. I want people to be honest. That is the only way that we're going to be able to move forward, is open and honesty. This is what I do in my own practice, really. I run this periodically. We address immediate concerns. We then build an action plan to addressing medium-term concerns, and then a long-term action plan as well. Okay, and sat behind all that is we provide a resource to every individual that goes through the platform, so they can monitor and maintain their own mental health and well-being, as well as a resource for the practice owner or the practice manager, whoever's going to run the program, to be able to then make business decisions that are very easy to implement, that allows them to start creating this cultural shift to a more positive direction. So I agree with what you said that you did on yours. However you decide to capture this data, but I think you've got to capture good, high quality data. That's important. So I think utilising one of these platforms is important.
And the key word that you said was anonymising it as well. I know you said you can kind of tell because you're a small practice, but I expect there are going to be bigger practices that won't be able to find out sort of that information. But anonymous is important because people need to do it in a safe space.
Yeah, it's cornerstone of psychological safety, isn't it? You know, in terms of people have to have a safe space environment to speak up in. And that's why I said that I frame it before I embarked on this journey. I knew straight away that I haven't got enough people in my practice to have it completely anonymized. If 2 people put a score out, because we score things out of 10, okay, across 40 domains. If 2 people put a score, I wouldn't know which 2 people have put the score. Some could score it at 1, some could score it at 10. I wouldn't know who that is. But as soon as somebody free texts, I know my people. I know the way they write. I'm going to have an idea of who said what. So presenting this beforehand, to saying to people, look, you know, we really want to know what's happening, what's going well, what's not going quite so well, how can we help, how can we support you? We really want to know all these things. Got people on board to be open and honest. And there's been some hard-hitting conversations off the back of that, you know, but I don't shy away from it because I know the reason why we're doing it. We're doing it for the overall benefit of the practice and for the people within it.
Yeah. And I think following on from that, there's sort of 2 things. I know I want to probably finish on listening because that's the main importance of actually why you do these kind of surveys. But I know, kind of to paraphrase sort of a clinical thing, it was always, and I can't remember who said it, but it was always a phrase that if you listen to your patient, they will give you the answer. And I think, to paraphrase that, if you listen to your team, they will give the answer as well, really. But I guess actually it probably ties all in together. The first part is, how do you actually get a lot of practice to buy into doing this? Because if you think about how many practices there are around the country, there's probably very few practices that will kind of engage on this on a regular basis. And if they do, I think what you tend to find is they'll do it as a one-off thing, and then that's it. They just won't actually do it again. They'll kind of go, right, you know what, I've got the answers that I wanted. You know, I don't need to bother doing it again. So I guess, yeah, how do you get practice to buy into this first?
That's proving a tough challenge.
And I would agree.
And that's an honest answer. That's proven a tough challenge. And you know, companies like Practice Plan are helping us as Synergy, you know, partner up with us to do this and offering it. So that's help. That's the hard part. Going back to what you said about, oh, we've done it, we've got the answers. How have we got the answers all the time? We haven't, because like everything, mental health and well-being is a ever-changing dynamic state, is it not? So we fluctuate on a spectrum all the time, on a continuum, whatever you want to call it. Yeah. So it's about trying to change the mindset of probably the practice owner, or the head of corporate, or whoever it might be, to say that, yeah, you know, it's a bit like, I see a lot of, I work with a lot of businesses across a lot of different industries and sectors. And, you know, I have companies tell me that, oh, yeah, you know, we support mental health and well-being. You know, we have fresh fruit every day in the kitchen. Okay, that's great. That, you know, fantastic. Encourage healthy eating. I'm all for it. But what impact is that really making? Or we invite our people to go to a yoga session. Fantastic. But what I'm talking about is building long-term strategies that is going to inspire sustained positive behavioral change that is then going to stick. It's a bit like going to a CPD course and you learn a new technique and you go, yeah, I'm going to try that. And you try it for a week and then you start to slip back into your old habits. Okay. So without continually measuring over time and having longitudinal data, you will never have all the answers. And even if you have longitudinal data, you will still never have all the answers, because everything is changing all the time. Personnel changes, team dynamics change, you know, patients change. Everything changes throughout time, doesn't it? So I think you have to go into this with a mindset. So on our model is a year-long model. You can have as many data collection cycles as you want in that year, but it's a subscription-based model on a monthly basis. And for that very reason, to encourage people to do this over a year, and hopefully after the year, they see the benefit in doing it, and then they renew the contract for another year.
And you mentioned about change, I guess, and change is something that probably, that's the biggest factor in kind of the mental health conversation, is actually it's how do people cope with change, because that's what makes it difficult. And I don't have a question based around it, but I'm going to mention that there was a book that I only just got delivered last week. It was actually something that one of my colleagues sort of, who's another associate in the practice, it's called Who Moved My Cheese by Spencer Johnson.
Very good.
I don't know if you've heard of that one or not.
I've got it.
You got it right then. So she even told me not just to read it once, but to actually read it 2 or 3 times, because we always find different answers within it. So I guess if you've actually read it and you know all about it, can you give us a quick summary? Because you said about changes, dynamics change. You'll find, you know, teams will change because people come, people go, or situations change in the practice. How, you know, and it's all about adapting to change. That's the important part.
Yeah. I'm not going to give you a summary of the book. I'm going to let people read that. But, you know, change management is difficult. Change management is hard. You know, as human beings, we fear change because it pushes us out of our comfort zone. Okay. And this is the whole cornerstone about building confidence. Okay. The more and more we push ourselves out of our comfort zone, the more and more we increase our confidence. And eventually that will lead to a situation whereby then we can then tackle all those things that are a little bit more overwhelming that we can't seem to tackle ordinarily. Okay. So we fear being pushed out of our comfort zone as human beings. However, it's actually the best thing for us. And to do that in bite-sized chunks is even better, because that builds confidence. It builds resilience. It allows you to learn from failure. You know, fail forward, fail fast, as they say in all that business, or fail fast, fail forward. You know, it allows you to take on things that you are not ordinarily thinking that you can manage, and that creates a great sense of achievement. Okay, so I think communication around change is super, super important. Okay, having people informed and prepared for what is going to happen and being part of that change process, which is why I'm talking about it's so important that not just us as the owners of the business drive the change. It has to be driven by everybody. People have to buy into it. It comes back into your shared values and purpose and all those things, those messages that you get with your team. people need to buy into the change, so then that change goes as smoothly as possible. We're having a big change in our practice at the minute. My associate has had to leave quite suddenly due to personal circumstances, and that's had a real negative impact on a few of us in the practice, but also a positive impact as well, I would say. It's meant that I'm around the practice a bit more. I took that as a positive. I'm not sure my staff do, but I've took that as a positive. I'm around the business a bit more because I need to be around to provide the clinical dentistry as well as also overseeing a bit more things. So, but the communication around that change has been every step of the way and involved everybody concerned, and that's the important part of change, because we can't control everything. All you can do is control what's within your power.
No, I think I sort of might need to think about my own approach slightly, because I've always kind of tried to go with reward and gratitude as well. And one of the things that I've sort of done, and I'll do this without fail since I've been an associate, is I've always bought every single nurse I work with an Easter egg every Easter, and I've always bought them like a Christmas gift, and that's coming from me as an associate. That's not even as a practice owner. But I've just done it standard, and I think people find that kind of thing appreciative. And, you know, we go out, like sunny day today, you know, I'll always buy ice cream at lunch, that kind of thing for all of them. But, you know, again, that's not actually, I think, looking at the change and kind of how people are reacting. I think that's literally just sort of tapping into their, it's almost like a form of conditioning in that sense, rather than actually, trying to tune into what's actually going on for them.
First of all, don't stop buying them an Easter egg or a Christmas gift, because your nurses will come at me and have a go at me. Okay, so don't stop doing that. It's really
That's
nice.
If they listen to this.
It's really nice what you do. It's really nice, and I'm not saying that we shouldn't be those little gestures, and I'm not saying little, but you know, those gestures of appreciation are super, super important every day. You know, please, thank yous. You know, showing people that you care, showing people that, you know, whatever way that is. What I'm saying is though, is that they are small little things in a much bigger picture, and all those small things build up to improving that bigger picture. But I do think that we need to get beyond these gestures, so-called gestures, or whatever it might be. I think we need to get into the real nitty-gritty of things. We really need to start understanding what is happening in our teams and within their lives. And they might not want to open this up to you, and that's fine. It's a slow process, okay? But the more and more that you can help from a business level, because we know that your work life and your personal life are intertwined. One doesn't go without the other, generally speaking, because our mental health is impacted by both, okay? So the more and more I can do personally as a business to improve the well-being of my team that's within my control, the more that that's possibly going to have an impact on their whole life holistically. That's the way I come at it from. And I still buy all the gifts that we talked about. Even as an associate, I did all that as well. But I think there's more to it than just a company saying, yeah, you know, we have a spa day, or we do this or we do that. It's an everyday living and breathing cycle of it.
I think that's an important point, because, like I say, the gifts and all the other bits, they're kind of a superficial thing. And you say it is part of that bigger picture. And that is, a big factor to it is making sure they actually do have conversations on a deeper level. So I think that's how probably you do connect with people, are those kind of conversations. And it does bring together people in that way, because when you do have those kind of conversations, it opens up a big part of trust in them as well.
Definitely. And, you know, you mentioned the word connect. That is a hugely important word, connection. It is so deep as a word, actually, you know, and also part of, we talked about change and change management and whatnot. But when you are in something together, that is a really deep connection, because you're in that together. You're in part of that whole change cycle together. That's the big thing. So connection and togetherness are just two massive words, really.
I agree with the change cycle, and and it is about sort of togetherness with people, and whether that's a small group of people or even just two people, it's about sort of progression with somebody else. I always say, you know, just like exercise, if you're doing something with somebody else and you've got that accountability body, you know, and people say mental health is kind of like, you know, and how how you're doing things. It's like a form of, brain exercise essentially. So I guess by doing that, you are actually creating an accountability body there as well.
Definitely. And also by involving your team in decision making, that creates accountability because we're all part of it. It's not just me as the principal who's accountable for all the decisions that happen. And there you go. If we all get involved and we all be part of this decision making process, we all become accountable.
And I guess the last thing that I sort of want to finish on is you said about listening, and I think I wanted to finish on this one purposefully when you mentioned it. I think there's two things, because we've talked about listening to your team because they will give the answers, but you said that a lot of practices or or management within practices, and whether that's corporate or independent, I don't think it makes any particular difference there. A lot of people think, right, you know what, this is how we want our practice to run, we know what we're doing, and we don't, and I don't want it done any other way type thing. So I guess the first one is, how do you actually, looking at it from the other side, how do you get that person who needs to listen, and and I know that's a very difficult one, and then I guess it's, once they have listened, what happens if the change doesn't come?
That's hard questions.
I know it's hard.
Thanks for ending on that. How do you get someone to listen? In my world, it's difficult. It's difficult. Actively listening in general is difficult, especially as dentists. Actually, we touched on this previously, I think. How do I get someone to listen? I think having to build a connection, so building trust with that person. So let's say you're the practice principal and I am going to pitch my services to you. I want to outline what we're doing, why we're trying to do it, how we're doing it, how easy it is for you to implement, and why you should do it. These are the benefits to you. So gaining a rapport with you, gaining trust, but then also outlining the benefits or the potential benefits to your practice as to why investing in a program like this is so crucial. Okay. So I suppose they're the steps that I'd take in terms of hopefully getting someone who is a non-believer, shall we say, to try and believe, or to try and listen, or to try and engage in this. How do we then measure the impact of change? Well, I think we answered that earlier, if I'm honest. To then measure the impact of change, the only way to do it is to repeat testing. It's a bit like measuring the impact of change in a patient. We constantly do an examination based on risk, 3 months, 6 months, 12 months, 2 years, whatever it might be, based on risk. And we're looking for whether gum scores have improved, caries, risk has improved, etc., etc., etc. That's how we measure it within patients. It's a similar sort of principle. If we get people to buy into long-term strategies and long-term thinking and collect data over time at certain importance intervals, then we will then start to be able to evidence change, good or bad. And if it's bad, we can course correct. If it's good, we continue on that trajectory. So I hope that answered your questions. They were two difficult questions to answer.
I know that's so hard, because I think you do seem to find a lot of it, and people say, oh, I've said it, I've said, what could be improved, or what's going on maybe, and then sometimes it's kind of like, oh yeah, right, people sort of go, yep, okay, fine, but then whatever, for whatever reason, and there's obviously a lot more going on, and it's not quite as simple as just, right, what, that needs changing, and let's get it done, because it's it's something that's going on within a much wider business. It's just a small thing within a big cog, but then people are going, oh yeah, well, I said it, but it's nothing's changed, and that's kind of and I know I can see how that might frustrate people, but I guess when you look at that kind of brings us back to Who Moved My Cheese.
Yeah.
Because that's all about also how you're trying to deal with that situation when the change doesn't happen that you want. Is how do you then deal with how you need to change to try and get into that. So I guess, we'll let people read it for themselves and find the answers and their own conclusions on that.
It's adapting your mindset, isn't it? And it's adapting your mindset towards change management. If you go back to the phrase that I used before, you are only in control of what you can control. Okay. If I cannot create a change or a shift or a cultural shift in mindset of somebody, I accept that I can't create that. But that doesn't stop me from doing what I need to do, because all I can do is move forward and try and work with that person to continue trying and change it. But they have to want to change. Yeah, it's that similar sort of principle. So it's going back to, again, the part that we touched on about having, well, if change hasn't occurred within the practice, so, you know, we said this was going to happen and it hasn't, then back to our accountability then. Well, who's accountable for those parts of that change management cycle? Was it me? Was it the practice manager? Was it all of us collectively? But we all agreed it collectively. So we come back to having those conversations. There's no harm or shame in having to go back 2 more steps to get forward another 5. But as long as we're constantly striving to move forward, that's the big thing. And moving forward together.
Yeah, no, I'm fully with that. And, you know, I know recently I went to an event. I don't know if I can talk about sort of, well, I can talk about the event. I just can't mention names, I suppose. But there was a big kind of focus on growth, and that's whether it's growth as an individual, or that's growth as a, you know, that's a collective. But that's a big topic and something completely different for another day, I suppose. Yeah. Because, you know, there's a lot more to it than just going, yep, we're all gonna, you know, we're all gonna change and we're all gonna do this and we're gonna grow like that. It's not quite as simple as just saying those words.
Yes, 100%. Yeah, and like I said, you've got to live and breathe the stuff. You know, that's the only way you're going to get it.
That's just it. I think we'll leave it at that. Are there any sort of final points that you have just to finish on, or any sort of quick summaries that you want to say?
No, not really. I think we touched upon the power of collecting data is massively important. You know, confidential, anonymized data. I think the biggest tip that I can give anyone is you know, have really good lines of communication and keep conversations open and honest, and strive for that common goal of moving forward.
Yeah, no, I think we've kind of covered some good points, because I know we sort of talked about things like gratitude and reward and little things that kind of keep people happy. But without sort of that big factor of change or listening, that's sort of, yeah, they're the most important 2 things. I think we've got a good take-home message from that. Great. I think, yeah, it's not there. Thanks very much for joining us, Rick. And
thanks.
I'll let you sign off.
Yeah, really enjoyed it. Cheers.
Thanks again. Bye.
Cheers. Bye. Bye.